Good afternoon. I'm Elizabeth Hess. As always, I would like to thank Urbana Mayor Diane Marlin for letting us do these wonderful reports with Julie Pryde, the administrator of the Champaign-Urbana Public Health District. I also want to thank you, Jason Liggett. Thank you for UPTV and production of these videos. Good afternoon, Julie.
Good afternoon.
Let's start with there are 3 counties in Illinois that haven't reported any cases of COVID. Is that possible? Are they not testing? Are they that lucky?
It's possible. I mean, some of these counties hardly have any people in them. So unless, they got it. I mean, the thing with the virus is it doesn't just like blanket the entire world at the same time. It goes from person to person to person to person. So, it's possible they don't have any. It's also possible that they could have some people that weren't sick enough to get tested. So it's hard to say.
Well, here in Champaign County, where are we with the numbers as of today?
As of yesterday, because we'll update them again, of course, today at 4, but as of yesterday, we had 387 cases. 174 of those are active cases, meaning that they're current infections with those individuals being in isolation. We have another, we have 3 who are still hospitalized. Of course, we've had the 7 deaths, unfortunately. What's notable right now is that we've done over 8,400 tests in the community through Carl and Francis Nelson and Christie and OSF and the other places that are doing testing. But right now, we at Public Health are following about 19 outbreaks. So that is what happens with an outbreak is that means 2 or more individuals infected within the location. So we're still too early in to know if these will be small outbreaks that are easily extinguished or if these are going to spread. What we have noticed in a lot of these workplaces, because you have to remember we're having 19 outbreaks right now and there aren't that many places allowed to be open at the moment, but these are all workplace associated outbreaks. So one of the things that we need to make clear to people when they do start back to work or the people who are currently working is that you need to stay away from your coworkers. You need to be masked up all the time when you're not at your own individual work spot. So make sure that you are masked up and that you don't go to breaks with people and stand too close to them. You don't ride in the cars with them. You don't go to lunch together, things like that, because those are all opportunities to become infected.
Well, a lot of us have to return to work soon, so your advice is very helpful, but we have a microwave and we have a refrigerator and of course door handles and the copier. How do we keep ourselves safe at work with all of those shared commodities?
Well, here at Public Health, what we do on a lot of those shared items is we have bought some kind of plastic that goes over it, and then we're able to wipe those down because you can't really spray off the keys of something very easily. Laptop, we have shared laptops in our emergency operations center, so we have plastic over them, and then it's kind of like saran wrap type of stuff, and then you just can spray that off or change that frequently. But most importantly, I think when people go back to work, we've all got to do 3 things basically until we get a vaccine. We have 3 things that we have to do constantly. Stay away from each other at least 6 feet, no matter where you are, no matter if it's in your leisure time or your work time, or if you're in public. Wear masks whenever you are out in public and around people. And like I've said before, at our place at Public Health, if you're sitting at your workstation, you have your mask off if you choose. But once you stand up or once anyone comes into your area, the mask goes back on. So the mask is on anytime we're moving about the building, anytime we're not at our workstation. And then the other is just really pay attention to hand washing. Because again, if you commonly touch surfaces that have the virus on them, but then you sanitize or wash your hands, then you're going to be fine.
A lot of things are still closed, as you just mentioned, and our stay-at-home order goes through effect on May 31st. So June 1st, the county opens up again. Are there protocols, or do you think we're ready in order to do that at this point?
Well, so we move at the end of the month, we're moving into phase 3. So that does not mean everything is going to be open, but there will be things open. There'll be retail openings, some more manufacturing jobs will be open, probably salons and barbershops, places like that. what you need to do though, especially if you're a high risk individual, is you need to determine if just because something's open does not mean that you need to go to it. So you need to make choices for yourself, but always, no matter who you are, no matter how healthy you are, make sure that you're doing the three things: the mask, the social distancing, and the hand hygiene.
I've been hesitant to go to get tested just for no reason, and now there's a giant tent set up at the mall.
Mm-hmm.
There are nasal swabs being offered now. Is that different from what's been offered up to this point?
That is different. So before it was a nasal pharyngeal swab, and that the swab is about yay long, and it looks like a Q-tip, a wooden or plastic Q-tip, and it goes in and all the way back, clear back, and touches your pharynx area. So that is a whole different, that's a whole different sensation than the nasal swabs, which is just basically a Q-tip-like item where you swirl it around in your nostril. And at the mall, at the community-based testing site that's available out there, you will do your own swab. So they will hand it to you and you'll swab it and they'll put it in the container and off it'll go to the lab.
So once you get that swab, it goes for contact tracing, and CUPHD is handling all of that?
No, so what happens once we get the results back? So all of the testing that's done pretty much in Champaign County, most of it goes through Carl's laboratory. We get the results back there between 24 and 48 hours, usually under 24 hours. And if it's a positive test result, then all those come to CU Public Health District, and we follow up on every single positive. So what we do is we will call the person. So make sure that you realize after you get a test, you'll probably get a call from public health. If you're positive, well, you will for sure if you're positive, but you also could get one if you're a contact of someone who tested positive. So please answer your phone if public health's calling. What we will do then is we will follow up. We'll talk to that individual who is positive, find out, what their needs are currently, but then also find out where they've been during their entire infectious period and try to determine who were close contacts of them. Sometimes that's people at their job. Hopefully it's not other people, like they're out socializing, but it's almost always household contacts. So then we follow up with everyone and offer them testing, and then have them go into quarantine until their test results come back, or if they develop symptoms.
From your insider intel, for lack of a better phrase, have you learned anything more about a vaccine? Are we still more than a year away?
Yeah, it just absolutely takes time. They are working on it literally all over the world. Places are working on developing a vaccine. But once they get a good candidate for a vaccine, then they have to make sure that it is safe and effective. So that takes some time. We're not going to do years-long studies. The CDC or NIH or whoever's going to do it is not going to take years and years to do it. But even on the fastest track possible, they have to be able to prove that it's safe and that it's effective. And then they have to be able to find a way to ramp up production in a meaningful way so that we can get the vaccines and get them out to everyone.
Julie, let's talk about kids for a second, because up to this point, it's the elderly, people with pre-existing conditions that were at the top of everyone's worry list for this illness. But inflammatory issues in joints and things have now been presenting in kids. Is this just as dangerous for children now?
Well, so you have to understand that there probably haven't been a ton of kids infected with this yet. A lot of where this initially came in, when it first started here, it was coming in on usually travelers, people who were, traveling to other parts of the world, or people who were on cruise ships, or then people getting it now through their jobs. So there haven't been a ton that we know of cases in kids, except for in households and outbreak areas. So as more kids get infected, we're going to start seeing more things. This virus is so brand new that we do not know all the different ways that this could present itself. With the kids and the even younger, healthier people, what seems to be happening is their own immune response is causing the problems. So if your own immune system attacks, like it seems to be doing, your blood vessels, and it's attacked everything. I've read everything from the aorta all the way down to little capillaries. So depending on where the inflammation is happening, how widespread it is, it can cause everything from a heart attack to a stroke to multi-system organ, multi-organ failure, multiple organ failure to amputations to what they call COVID toes. So all kinds of weird things. So I just know, you know, from history that you learn a little bit about things as you go, a little bit, and then it gets bigger and bigger and bigger. And we're still so new on this that you have to just know that we don't know what's coming around the corner next. So I think what's concerning about that is, like, I always use 1918 as an example. Of course, that was flu, but you can also use HIV and other things, so that when you first start noticing it, you notice the obvious thing. So you focus on the one thing, because that's who's getting infected. So it was the respiratory symptoms. And then they were like, oh, well, this is also happening. And as more and more people get infected, then more and more things get added to the list. So with 1918, the first wave that came through killed mostly elderly people as well, and sick people. The second one that came through, of course, that was the one that killed almost, you know, an unbelievable amount of young, healthy people, mostly people that were in the military. So, you know, we're only months into this virus. So we still have to be cautious and know that we don't know what's coming. Could be better, could be worse. We don't know, but we do know that there will be another wave, and we do know that that we have to prepare for it.
If we open up too quickly and that second wave hits, we could be right back where we are, right? Sheltering in place.
Yes, I mean, the main thing, even though we have a lot of cases right now, we're still in really good shape in our community, because the hospitals are still in great shape. So they have to maintain their capacity to be able to expand. So you have to have, if you notice on the Restore Illinois plan, you'll see that a lot of the metrics that we're looking at have to do with how much capacity there is for the healthcare system. So what does the personal protective equipment look like? What is the bed capacity at the hospital? What is the capacity for the ICUs and the ventilators? So all that has to be assessed all the time.
While we're on the subject of children, K through 12 is about to get out of school, and I'm always concerned with the kids who get free and reduced lunches. Mm-hmm. Doesn't your staff do something in order to help them over the summer and year round, for that matter?
Yes, and all of the summer food sites, they will be different, but it's my understanding that they're going to continue. So even though it's not going to be kids coming into public health and eating, we will be getting the food out through these various sites like they're doing now. I mean, the schools have done an amazing job stepping up and getting food out to kids during this shutdown period. And my guess is that it will be something very similar to that moving forward through summer. So it will probably be just expanding that program. We know who the kids are, and we already have the ways in place to get the food to them. So I think that's how it will continue. But we, you know, we'll take care of the kids in our community, all of us together.
Yes, we will. A couple of Congress people, let's start down in Florida and Texas, want to open things up, and they say, let's have herd immunity. The virus is a virus, is a virus. What are we going to do? Is that the absolute wrong answer?
That's a ridiculous answer. Yes, of course, a virus is a virus, but that doesn't mean that we want everybody out there to get it, because first of all, we do not know if infection leads to immunity. That is a key factor. So, for example, you know, there are other viruses out there you can get repeatedly. You don't encourage people just to get it over and over and over. That's a ridiculous idea. If we were to a point where we knew that infection conferred immunity, even if we knew that, we still could not say, oh, let's just open up and whoever lives, lives. That's just a ridiculous concept, because there are simple ways to prevent this and to protect those who are most vulnerable. And while it is hard, I'm not saying that it's not hard, or it's not unusual. It's not hard. It's not hard to wear a mask. If you're medically able, it's not a difficult task. And if I can wear a mask to maybe prevent infecting someone if I'm asymptomatic and possibly killing them or killing a family member, that's something I'm going to do. So just to say that, you know, and again, younger people and certain people just have this invincibility cloak that they wear. They think that they're invincible, but that does not mean that they cannot transmit that to someone who is not invincible. It also does not mean that they are invincible. So we do not tend to make policy or make public health decisions on magical thinking.
We are coming up on summer events, and of course the Illinois Marathon was canceled. My personal favorite, the Sweet Corn Festival, is not happening. Is it going to be a long time, at least a year, before anybody should be having gatherings of mass proportions?
I cannot see how it would be possible until we have a vaccine or until we have an effective treatment or prophylaxis treatment. I just don't know how that would be possible, because you would have, you know, massive outbreaks that would definitely overrun a healthcare system.
I have one more question for you. Actually, this one comes from my mother. Her salon opens on June 1st, and she wants to know, is it safe? She puts on a mask, her stylist puts on a mask. That's 2 weeks away. Should she just sit there and have somebody breathe on the back of her neck and cut and color her hair?
Well, I mean, again, it all depends on people's individual choices, but I do know that the salons are really looking at best practices for infection control. And just like the stores have done, if you go into stores now, you see that they've really stepped up. I was in one this weekend. I've been in Meyer, I've been in Schnucks, I've been in County Market, and I've been super impressed with the things that they're doing to make sure that their employees are safe and that the customers coming in are safe. So salons are, by us starting earlier than some places, Illinois will be able to learn from some of the other places that maybe develop best practices. So I know that they can do it safely, and it will look completely different. There won't be people sitting in the lobby reading magazines waiting their turn. It'll all be done by appointment. There will be a lot of changes, but you know, it is possible to do things safely. But again, if I was at high risk, I don't know that I would.
Okay, and I know that you're going to update the website and the Facebook page today, every day at 4, but I'd like to give you the last word today. Just give me something that you wanted to cover that we didn't ask about.
Well, I guess I can talk about real quickly the testing that's going on out at the mall. So that is, let's see, it's called a community-based testing site. It's at Marketplace Mall, up where the old movie theater used to be. It's going to be running from 8 to 4 every day. And it's going to be 7 days a week. So pretty much anyone with symptoms can go out there, just drive out there. You don't have to do anything special. You don't have to get a code or anything. And then if you are someone who's at high risk, you're able to go out there as well. And if you are someone who basically is working right now anywhere. So if you're working in the grocery stores, or you're working in pharmacies, or you're working construction, or you're working at restaurants, or in the media, or at public health, or basically anywhere. If you're working now, and then again, once places open and you're working in the new expanded jobs, you'll be able to go out and test. So it's available, it's free, and we want people to feel comfortable using it. It'll look different because the National Guard is doing the logistics for it, because that is their thing. They are super good at doing logistics. So it's a combination of Illinois Emergency Management, the National Guard doing logistics, individuals will be collecting their own swab, and the Carl Lab will be doing the laboratory work. So it's a free resource out there, and I hope people take advantage of it.
Thank you so much to Urbana Mayor Diane Marlin. Jason Liggett, thank you again for being our producer and making us sound good. And a big thank you to Julie Pryde, the administrator of the Champaign-Urbana Public Health District. Thank you for all of your efforts, and stay safe.
Thank you. Stay safe.